Every family has a choice: follow the herd or carve their own path. This is the Lone Wolfe Podcast. Are you ready to stray from the pack?
Welcome to the Lone Wolfe Podcast. Hello!
Welcome to the Lone Wolfe Podcast. I'm Morgan. This is Jordan. We sold our house and everything in it to travel the country in our 22-foot pull trailer with our two daughters.
Okay.
We chose an unconventional lifestyle on purpose in search of something deeper, a true freedom, self-reliance, and sovereignty as a family. Along the way, we're going to have real conversations, such as this one.
Yeah, today we're talking about everyone's favorite topic, dicks.
The male penis. So we've had this idea of doing a 2-part series on dicks and then tits. But the reason why we're bringing dicks to you this week is because there has been a kind of viral post that's been going around. For the first time in American history, we are seeing a shift towards more intact baby boys than circumcised baby boys. I did go and fact-checked it. Check it.
Yeah.
Because it's the internet, and there's not actually more intact boys quite yet, but it is trending that direction, and we're actually pretty close to 50-50. The important nuance there, though, is we're talking about like baby boys. So it's this like new upcoming generation. So I guess maybe I have like almost an insider's perspective that you haven't experienced because I work in birth work. Right. So we're having those conversations with moms while they're pregnant, and we have an evidence-based form that we push over to all families. The third trimester being like, if they're having a boy, are you going to choose to circumcise your baby?
Right.
So I see a lot of families making those decisions, and it's not common that, at least the people who are in the home birth setting, it's not common that they're picking circumcision. And I think because those things kind of go hand in hand, there's this weird idea that people who give birth at home are careless, that they're negligent, but really the people who are giving birth at home are some of the most intelligent people there are, because they research so much.
Yeah.
I mean, they research everything, and they're the most informed individuals most of the time, right? Going into a out of hospital birth, that once families start making those informed choices around their pregnancy, where they're going to give birth, how they're going to give birth, whether they're going to be giving vaccinations, like whether they want immediate skin-to-skin, delayed cord clamping, all of those things require research in making a decision. Circumcision is one of them. And most people who are choosing this more like holistic, natural way to bringing their babies in, earthside, look at circumcision and are like, why in the world would I do this barbaric procedure on my baby boy after birthing them peacefully in the comfort of our own home?
So you're looking at it and you're going, okay, well, why did they start doing it in the first place? And a lot of the science around it is saying it was for cleanliness and to help prevent disease.
There wasn't even science though. Like I went and, of course I had these questions and I looked back and it was more speculation. It was 1800s to early 1900s before germ theory and all of those things. It was just speculation that it's a dirty thing. And if you remove this literally piece of little boys' genitalia, that it would make them more clean.
Right.
It was more theory based than it was evidence. At that point, nobody was researching it and doing trials on these things, you know?
When we looked into this a little bit, and even before that, the initial reason why they started circumcising outside of religious purposes was to prevent masturbation.
Which is insanity.
It's crazy.
That's absolute insanity.
Yeah, that's insane.
I know. Well, and if it was flipped in our culture, if the roles were reversed and we were cutting off infant girls' clitorises because we don't think that they should experience pleasure as adults. Could you imagine if that was happening in the US? Like,
yeah, there'd be outrage.
but then we can do it to baby boys, and
Right.
that's fine.
Well, I think the problem is men are less likely to speak up about the anatomy of their genitals. You know what I mean? Like, I think that there's a lot of men that it's already happened to them.
Mm-hmm.
And it's kind of like
a disassociation almost from like
I'm not going to call out the mutilation that was performed on me as a child because one, I don't remember it.
Yeah.
And two, I'm not going to make it weird for myself.
Yeah.
You know what I mean? So I think there's a disassociation, like you said, with it. And I think it's like, it happened, let's move on type of thing.
Yeah. I mean, we just heard this. I don't remember if you were in the room yet, but I was listening to an expert on circumcision because we certainly aren't. And I was just listening to, his thoughts and stuff. But he was saying, if you go and get like any other procedure done, like you get a nose job or something, you don't say like, I am a nose job. You know what I mean? Like you don't identify with any other procedure. But when it comes to circumcision, it's like either I am circumcised or I am not circumcised. Like it becomes part of your identity almost. And so then to say like circumcision is bad, if we were to accept that as a culture, then that's men being like, I am bad.
Right. There's something wrong with me.
Yeah.
Yeah. That's kind of what I was trying to say. It's like, you don't want to openly admit that something bad has happened to you.
Then another interesting thing that he said as well is if the like medical, world says circumcision is bad, we were wrong. We never actually knew that it was healthy and safe for young boys. Whoops. Now they're claiming that this is wrong. They can now have a bunch of lawsuits against them.
Yeah, absolutely. If they're claiming that what they've done for so many years was not the right move, not only like as an option, they pushed it really hard. And I think that a lot of parents, when they had a baby, would go automatically and just say, yeah, we're going to circumcise because there was a stigma around it. Because that's what was recommended by the doctor. That's what was recommended by the physician. And you need to go with what they say.
And there's a lot of weird, almost like gaslighting by these providers to families too, because if families come in and are like, I'm not sure if I feel totally comfortable with this idea of circumcision, and they ask questions like, do you use pain medication? Do you sedate the baby for this procedure? They don't, from my understanding.
Which is actually crazy. Like, you're cutting one of the most sensitive areas on the male body as a child. And even though they're just a tiny baby, there's got to be some physical trauma attachment to that.
Well, there's studies that say like if you don't hold a baby enough, like if they don't get enough held time by their caregiver, that there can be trauma.
Yeah. And that same doctor that you were talking about was also saying like there is a period of time when a baby is building trust around the people that are around them, the mother, the father, the siblings, whatever. You're basically just destroying this trust because you're putting the baby in a position where you're deliberately harming it for a cosmetic reason. Well,
and they may not like cognitively remember, but they're gonna somatically remember. Yeah, like the concept that like your body doesn't forget.
Your body holds on to the trauma.
Yeah. Which is so disturbing. And we're doing it to these little boys that are, just a few days old normally.
Yeah.
Another take that I think is kind of interesting is so a lot of families are starting to question vaccines for their babies, and vitamin K is not technically a vaccine, but vitamin K is part of the like kind of early day medications that are given as like standardized protocols, so most families are starting to question vaccines. Like they don't want to give their baby the Hep B, they don't want to give their baby erythromycin, and vitamin K is also in there. So that one's also being researched, and families are kind of hit or miss. Like I'll say in our practice for like home birth and the birth center, I would say it's maybe like 60-40 on the vitamin K, like 60 don't and 40 do. But it's the most commonly picked one out of those three that I just said.
Really?
Yeah. But I mean, vitamin K, like it's not just a vitamin. Like, I feel like that sounds deceiving. It has all kinds of other like additives in it. Yeah. Preservatives and all that. So if families decide, I don't want to give my baby the vitamin K injection, but they wanted to circumcise, most providers are going to require the vitamin K injection prior to circumcision. So I think that alone might be some of the reason why we're shifting towards that 50-50. Like potentially we might get to a point where there are more intact boys. Obviously that's multifactorial, but I think just the mere concept that this younger generation, like you and I, are questioning things way more.
Yeah. And then you also have to take into consideration that majority of the rest of the world does not circumcise males.
Yeah.
Like all of the things that they kind of claimed for cleanliness and all of that stuff was debunked in other countries, and they weren't doing it. They were like, this doesn't actually make any sense.
Yeah.
It was more of like a cosmetic thing.
I think what's scary about circumcision is it really shows how easily things can kind of come on the scene and not necessarily have substantial evidence to back that it is something for the benefit of humanity.
Yeah.
But then once it becomes like normalized, once it becomes a standard, it's very, very hard to get it out.
Yeah.
And that's really what's happening. What happened?
New evidence comes out in the medical world and there's nuance to the whole situation, it's still really hard for them to let go of something that they can, one, charge for, and two, is something that they've already told a number of people that is the right thing to do.
And just culturally, we already kind of said this, but I see this a lot too, where families are making the decision on if they're going to circumcise and they're expecting a little boy, right? And the dad's like, oh, well, I'm circumcised, so we have to circumcise him. Right. And then the mom or the wife is just like, oh, I don't know what it's like to have a penis, so you make the decisions for our son then. If you say circumcise, then we do it.
Right. There's really no research that goes into it. It's just...
No, that's it. Literally, that's it. That's the conversation that's had. And then they go ahead and do the procedure.
Yeah. The son should look like the dad type of thing.
Yep. And there's no deeper conversation to it at all.
Yeah. And I mean, there's a lot of other aspects to it too. Like then you start to get into more like creepy, sinister stuff, and you're thinking you have to arouse the child slightly in order to do the circumcision, which you're like thinking about that and you're like, what? You have to arouse the child? Like, what do you mean? But there's an antiseptic that they put on the penis in order to stimulate it so that they can actually get it to a point where they can make a precise cut. And it's like, what the fuck?
This is their like first almost like sexual experience. And what they're learning is that like the more powerful man wins.
Right.
Because they literally wrap them up in like a straight jacket and tie them down to a board.
Right.
And they say that they do it in like soundproof rooms. I don't know if that's true or not, but they say they do them in soundproof rooms, and that if like families or, the people down the hallway could hear the procedures, then we would stop them immediately.
Well, not to mention you're cutting off a large portion of the like male organ that causes pleasure for a male.
Yeah.
It desensitizes your genitals, and the baby has no say in whether or not that's an option for them.
They can't even consent to something like that at all. They're completely unconsensual being. And I think that this is also where that shame comes in for parents, because we are the ones who can consent for our children. And, any of the previous generations who did consent to have this cosmetic procedure done to their boys, it would then be admitting that they did their child wrong.
Right. That's a hard thing to admit too, especially as a parent. It's kind of goes along with the vaccines as well. Like you don't want to admit that the advice that you took from a provider was wrong and that you maybe were duped.
Yeah. Or that your child was like harmed almost by your own decisions.
Right. Because you didn't look into it deep enough.
Yeah.
And
or had blind trust.
And I get that, because I understand. I mean, as a parent.
And we've been there.
Yeah.
We've made decisions before.
Yeah. We look back at it and we're like, fuck, we shouldn't have done that.
Yeah.
Yeah. It's tough as a parent to go back and look at those things and be like, yeah, I made the wrong decision at the time.
But how cool that we are literally watching a real cultural shift happen in real time. We're literally watching parents decide that just because something is standard doesn't mean that it's right for me or
Right.
my family or my children, that we want all the answers, right? Like we want to question, why should I do it? What if I don't do it? What's the history on it? Like who's incentivized here?
Right.
Who benefits from these decisions? Trying to take that power back into our own hands. And obviously it's showing. I mean, that's a big deal to be at a place where we go from 80% of, adult men being circumcised to now like almost an even playing field of 50-50.
Well, and I think it's also kind of cool to see like a stigma be lifted, because there was, like, even in popular culture, multiple TV shows where there's an episode where it's like, oh, she slept with a guy who was uncircumcised.
Yeah.
And it was this big deal, this big thing. And it was like telling their friends about it and all this.
True.
Yeah. It was all this really like taboo thing.
Yeah.
Like you're a weirdo because because your genitals are intact the way that God intended it. And that's kind of fucking crazy.
That's really weird.
Yeah. It's, it's one of those things where you look back at it, and if they did that now, or let's reverse the roles a little bit. And let's say that they were talking about women that way in a TV show where it was men. If you were putting that out there on mainstream television and saying, oh yeah, I don't know if I could see her again because her vagina was not circumcised and she had a clitoris, that would be insane.
Yeah. Yeah.
But it was no big deal because it was men.
I think what's scary about it is it's not even just like men versus women or anything. It's the way that we can be brainwashed is really scary.
Yeah.
You can't help but feel like if somebody could just come out at one point in the 1800s or whatever it is in America and be like, you know what? I think that if we remove part of a man's penis, he will get less UTIs and be cleaner. And somebody went, that's an interesting idea. And then they're like, let's try it a couple times. And then they do it. And then they realize that insurance can cover it and they can get insurance payouts and people will cash pay and whatever. And they realize like it makes more people take the vitamin K shot and blah, blah, blah. Now they're like, okay, cool. Now let's make it a cultural movement.
Yeah.
And then they make sure that there's propaganda and TV shows and cultural stigma to make sure that everybody who has a son will remove the foreskin. Like,
if not for the cleanliness, in fear of their child being ostracized.
Yeah.
That's crazy.
Yeah. So think of like how many other things have they done that same thing to us?
Yeah.
And how many other things could they do? You know what I mean?
How much time you got?
I know.
Yeah.
But I'm sorry, people say this whole, we're all conspiracy theorists and whatever. No, we're just like awake.
Yeah. And like when you notice a trend within especially within the medical system of them doing things because a doctor said so, but also that doctor wouldn't have any work if he didn't recommend it. It's almost like you're playing God. Like you're creating the problems so that you can go, you know what, I can fix this for you.
Yep.
And that's the problem.
It's really scary.
So I don't know. Again, this isn't just about circumcision. We're talking about dicks here, ladies and gentlemen.
All
but
dicks.
There is a growing issue amongst young men in America, and I think across the world, but specifically America in first world countries, where young men are now having to be prescribed medication for erectile dysfunction.
Yeah.
Specifically like the Viagra medication, and there's generic brands and different name brands around it. And
it's happening younger and younger.
Yes. And it's really concerning.
Is there actual data? Like, because I don't have a dick. I don't know dick things. Do circumcised men experience less pleasure with masturbation? Like, is that true? I know you were saying that was maybe part of the like sinister plots behind circumcision, but is there actually like validity to that?
So to answer your question, yes. Based off of the science and the studies, it shows that men who are circumcised do experience less pleasure during sex. The foreskin that they're cutting off has thousands of nerve endings in it.
Right.
And it also provides a more fluid motion when you are inside of a woman.
Yeah.
So
almost as if it was designed that way.
Yeah.
How crazy is that?
It's wild. It's almost like the way that we are built was specifically designed to give you the most pleasure.
Yeah. I mean, I'd be really interested if somebody would track then, another 100 years from now and see if there is a correlation. Like if we start seeing less ED in men as our circumcision rates kind of swing this way.
Yeah. I mean,
there has to be some amount of impact.
There could be some implication to that.
Yeah.
As far as like the amount of sensation that you feel during sex and that going away because your penis was literally mutilated at a young age. Like that is a possibility that the desensitization of your genitals is creating less sensation and causing you to potentially have less erections as a man. Mm-hmm. But there's a ton of other factors that contribute to it as well.
That almost instantly makes me think of like porn. And sometimes I feel weird like talking on it because it's not that women don't watch porn, but porn is definitely a very men-centric thing. You know what I mean? I have personally never been a porn user, but I would imagine like if you're not able to get the sensation that you should having actual sex with a real woman, why not go to porn and try to watch the most extreme whatever things, almost trying to get yourself to feel the way that you should. And circumcision aside, right? I think that porn in general, I imagine, is also impacting because then you have negative, implications of that where you can only feel arousal a certain way from watching these really extreme things. And then you go to have sex with a woman and it's kind of vanilla. You know what I mean? Like it doesn't have all these flashy whatevers. I'm keeping this PG. That all of a sudden you literally cannot, like I know that this has been studied, men get to the point where they literally cannot find pleasure in simple sexual acts.
Yeah, I mean, if you're watching on a daily basis, maybe even multiple times a day, pornography that is completely fake and over the top, and it's literally there to grab your attention and make you stimulated. If that's what you think a real intimate relationship with a partner is, then you have this completely inflated false sense of what that's supposed to look like. You're going into it with this expectation that it's all going to play out the way that you saw in this dumb movie on the internet. And you're putting your partner that is doing this, sacred act with you in a position to where they're doing stuff that they're uncomfortable with because you think that it's normal to not only get yourself off, but like that's what you've seen and that's how you've learned.
Yeah.
And that's got to be doing a number of different damages to a person's brain. And that would make so much sense as to why there is an erectile dysfunction issue amongst young men who are consuming that much porn. This episode of the Lone Wolfe Podcast is brought to you by Heart & Soil's Whole Package Supplement. Yes, the one with the actual testicle in it. You can keep pounding energy drinks and praying for a miracle, or you can fuel your body with real deal nutrients straight from nature's multivitamins. Beef liver, heart, blood extract, and yes, a little ball power. If you've ever thought, man, I wish I could bottle masculinity, congrats, Heart & Soil already did it. Packed with bioavailable nutrients, this stuff is designed to help you feel like the primal beast you were meant to be, not some limp noodle scrolling TikTok at 2 a.m. So get your vitamins and your minerals with a dash of testosterone straight from nature herself, because nothing says I care about my health like swallowing a little testicle. Use code LONEWOLF for 15% off your first order. Heart & Soil. Fuel up, get primal, and straight from the pack.
So I had a friend in college who shared like a sexual encounter with me and our other roommate where she went to hook up with a guy and we were, early 20s at this point. And he literally had to stop her and be like, hold on, I just need a minute. And he went to his nightstand or whatever and pulled out a bottle of Viagra and took like 2 or 3 or something first. And then I don't know if that ever worked out for them or not, but I remember her sharing that. And at the time, I was young and I didn't know all the things that I know now, but I was kind of like, well, that's weird. I figured he was just doing it for like extra pleasure or something. You know what I mean?
You know what?
And it makes me think maybe alcohol culture too.
I was not only that, but this is a real thing. So SSRIs, if you're prescribed, there's And the common side effect is not being able to get an erection.
Really?
Yeah. Just from like a personal friend's experience that was on SSRIs.
Really?
Yeah, it's a real thing. They had to take some sort of Viagra or stimulant in order to get an erection to be sexually active with the girl, because those SSRIs completely drown out your sex drive, and they also drown out your ability to be aroused.
Are these Viagras being like prescribed by a clinical doctor?
Yeah.
Are these most people's doctors being like, here's your SSRI, and also if you're choosing to be sexually active, here's your Viagra as well?
A lot of the time, yes.
Yeah.
There's also
I figured it was like he stole it from his dad or something. You know what I mean?
That doesn't need to happen anymore. You can literally do a telehealth doctor.
Yeah.
There's so many advertisements for young men to, like, there's a gum called Blue Chew that has the active ingredients in Viagra in it. And it's like you'll hear advertisings for it on podcasts. And
Really?
all over the place. I don't even think you need a prescription in order to get it now.
Like you could buy it over the counter?
I think so.
That's
and
crazy.
I might be wrong, but I know that the process to getting it is definitely not hard.
Yeah.
No pun intended.
No, you didn't. Yeah, and then I mean, my brain can't help but be like, man, I wonder what the side effects of Viagra are.
Yeah, or like, can you get an erection after using it?
I was gonna say, do you have to like wean off of it?
Do you have to like retrain your body to do that again? It doesn't sound like it would be in your best interest to get on it if you don't have trouble like getting an erection.
That's so sad.
But
honestly.
It is sad because you're going to somebody who's in a position where they either have some sort of mental health issue or they're clinically depressed, and they're doing what the doctor's telling them in order to try to make themselves feel better. Have they taken the right steps before getting on an SSRI, like sunlight and exercise and nature and diet and all of those things? Maybe not. But if you're going to your physician and the first thing that they've told you outside of that is, we got a medication for that. And then you're like, well, you're back at the doctor for, the next month's checkup, and you're going, my wife and I were trying to be intimate and I couldn't get it up. What's going on? He's going, oh, don't worry, we got something for that too.
Or how many guys just don't say anything? You know what I mean?
Yeah.
What a detriment to, your mental health even further.
Yeah. So I think on top of the porn, on top of the mental health, there is obviously diet is going to play into that.
Yeah. I think physical health is another big one to consider, because we are becoming, more and more obese as a society as the years go on. And, sexual intimacy can be like laborious sometimes. Yeah. And if you're somebody who has a hard time like walking up a flight of stairs, like you might not have the stamina to literally complete like a sexual act, you know?
Well, you can use your arousal as a sign of whether or not
of health.
You're hormonally healthy.
Yes.
If you're not waking up in the mornings with an erection, then there's probably something off.
See, and that's really interesting. And I like that concept because like as women, it's maybe a blessing and a curse, some may say, but we're cyclical beings. And so we have very different hormone patterns than men do. But because of that, you can do things like cycle charting, and you can see that you have like basal body temperature elevations, and you get cervical mucus, and you have, these different biomarkers within your cycle that indicate whether your hormones are functioning properly or not. And I feel like so often, at least in my little, world of women's health cycle charting things, you hear that like, oh, men are just simple and like there's really nothing to them, you know what I mean? But what you just said is honestly really interesting. Like it's kind of fascinating for me to hear it, because I don't think about men's health like that, but that's such a good point. And you know how many men probably have no idea like whether that's actually healthy or not? I
think the biggest difference is there's a stigma for men to talk about these types of things or to maybe bring up an issue. It makes you feel less of a man. Like it's like you wouldn't go to your friends and be like, guys, I'm not waking up with a boner and I feel kind of depressed. I can tell my health and my weight is an issue. Even the fattest dude in the room is going to go, oh, of course I can get a boner, because it's like a masculine thing. Like you don't want to talk about that with your buddies, let alone anybody else, or let anybody know that you're struggling with something.
Yeah.
Because it's a male thing to go, I'm going to bury this as low as I can and, hope that something gets better, even though I'm not making any changes for it, or I'll go see my doctor, order something like that. But I'm definitely not going to bring it up to anybody close to me.
Yeah. But then how sad, because then how do these men, go on to have healthy relationships if they can't,
Maybe that's why the divorce rate is so high.
I know.
Or part of the reason.
It could be. Yeah. Who knows? What about alcohol culture too?
Yeah.
Because whiskey dick is a real thing, right?
That's definitely a thing. Alcohol has a huge effect on your hormonal health, your fertility, and just your overall health if you're drinking regularly day in and day out.
But I imagine there has to be, you were saying, the mental health side, we'll take it back to my friend in college who had that, experience with this 22-year-old or whatever taking Viagra. It could have been after a long night of drinking too. Maybe it's not an SSRI. And I feel party culture and drinking culture for these young men, from their late teens all the way into 30s, a lot of men like that are going out and binge drinking often. And then you can't get it up. And maybe it's not necessarily a chronic problem, but they'll go and get the Viagra because they're well, I still want to hook up with the hot chick from the bar that night.
Bro, I'm bringing my Blue Chew out just in case, because I've been drinking. I've had 32 beers tonight.
Mm-hmm. Yeah.
And the only way this body is going to function with somebody who I probably shouldn't be doing this with is if I chew this dumbass blue gum.
Yep.
Yeah, it's crazy.
Yeah. And there's just so many factors at play for it, but there's definitely something going on. There's something impacting our men, and I feel it needs attention. You've already kind of said the hormonal perspective of it, which I don't know men's health. Do you have to have good hormones to get an erection? Are those related?
It's all related for sure. I don't necessarily know that you need to have optimum hormones to get an erection, because there's plenty of fat slobs that are reproducing. So, and you don't get somebody pregnant unless your dick's hard.
Yeah. Yeah. So that's fair.
Just saying.
Okay.
But yes, all of that is connected to hormonal health.
So sperm is another thing that we're seeing. There are projections, right? So this isn't an exact prediction, this is what's going to happen, but there are these calculated projections that the sperm concentration in American men goes down 1 to 2.5% every single year. And so there's this doctor who calculated out this projection saying if we stay on that trend, sperm will reach 0 by the year 2045.
That's scary, because that means that there's no more reproduction.
Yep.
And that's not that far away.
That's not that far away.
So they're moving the goalpost, is what you're saying. The number for optimum sperm is constantly being lowered.
It is, yeah.
In order to accommodate what it looks like to be a healthy male.
That's definitely happening. The average sperm concentration in the early 1900s I think was 200 million or something like that, something crazy. Now it's 30 million is considered healthy, and you can actually go and track back and see the years when they just lowered the parameters instead, because people just can't reach them anymore.
So in all of this together, you can't help but look at the steady decline in the number for free testosterone in a male's body now compared to 25, 35, 45 years ago.
Mm-hmm.
And that, along with sperm counts, has dramatically decreased over time on what it is to have a normal testosterone level as a young man, even into middle age.
Well, and I imagine there has to be protective elements to having healthy testosterone. It's the same thing for women. You want to have healthy hormone progesterone. Having good progesterone levels protects you from all kinds of things as a woman. It's actually protective of your overall health.
Right.
I would imagine testosterone has a similar effect.
Absolutely.
So we're not just talking about dick health here. We're talking about overall health for men is plummeting. So to tie it all together, maybe there's hope, right? That we're seeing for the first time in American history, that pendulum's kind of swinging. Right now we're in the middle. It's 50-50 on circumcision, but I'm hopeful that it's going to continue to go this direction to where we get to a point where it's 80% of, adult men are intact in the future here. And I'm hoping that by having parents, having families, people like you and I imagine a lot of our, listeners, that we are refusing to take things just at face value, that we are taking the power back into our hands, that we are questioning the systems at play, that we are not accepting, certain things as truth, and that is going to have this kind of downstream ripple effect on the overall health of these boys, young men, and adult men in the generations to come.
Yeah, just the numbers alone that we were talking about, as far as awareness and parents and people moving forward with circumcision, and the numbers coming out on low testosterone, low sperm count, how detrimental porn is to young men, SSRIs, the consequences that are really, really weighing on our health and our overall well-being as men. I think that there's more men speaking out about it now. It's one of those things where it just needs to keep rippling along, and people need to keep talking about it and bringing awareness.
I like that you say that, because I think that provides hope, because sometimes it's challenging in these spaces, and a lot of the topics that we talk about on Lone Wolfe, can sometimes feel so heavy and like, oh, we're all hopeless and whatever. And that's never our intention. So I like that you're giving that perspective, that we don't have to wait until more parents like us raise up the next generation, and that next generation then like make changes. There are things that we can do now to kind of shift the culture.
Yeah, absolutely. And if you are a parent, if you are somebody who has heard all this stuff and you agree, and somebody brings it up to you or asks you about it, tell them how you feel.
Yep.
Tell them what you think and what you know and your beliefs behind it, and maybe you'll create a change.
Be brave. And if you enjoyed us talking about dicks, make sure you like and subscribe, because next week we're going to be talking about tits.
Hell yeah.
If you feel at home here, leaving a 5-star review helps other families find their way too.
Come hang out with us on socials at Lone Wolfe Podcast, and don't forget to subscribe so you don't miss what's next.
Remember, sometimes you have to stray from the pack to discover where you truly belong. Until next time, loners.